Hello, and welcome to the Orthodontic Products Podcast. I'm your host, Allison Warner. In this episode, sponsored by Solventum, we are examining a major technological shift in clear aligner therapy, the transition from conventional intraorally cured attachments to preformed 3D printed alternatives. The traditional attachment workflow has long been a primary source of clinical unpredictability for orthodontic teams, largely due to the manual flash removal process and its downstream impact on precise tooth tracking. Our guest today is Dr. Thomas Crary, a board-certified orthodontist who practices at Milestone Orthodontics in Minnesota. Dr. Crary was one of the pilot testers for Solventum's Clarity Precision grip attachments, and he joins us to share his clinical insights on how integrating fully cured, preformed composite attachments can streamline daily practice operations, improve bond strength, and elevate the patient experience. Here's our conversation. Dr. Crary, thank you so much for joining me. I really appreciate it.
Good morning. Happy to be here. Thanks for having me.
Yeah. Okay. So let's kind of start with getting to know you a little bit. So, as both the practicing orthodontist and a Solventum partner, can you share a little bit about your practice and how does aligner treatment fit into your day-to-day workflow at this point?
Absolutely. Yeah, a little bit about me. I was born and raised in Minnesota. I pursued engineering actually as an undergraduate degree, but like right at the end of it, I realized I want to be an orthodontist and pursued that. Went to University of Iowa for dental school and residency as well for orthodontics. Graduated 2018 and joined a group practice that's now called Milestone Orthodontics back home in Minnesota. And have been there ever since. Love it. I've got 3 amazing partners, 6 locations in the northwest suburbs of the Twin Cities. We do quite a bit of aligner treatment. Maybe 20 to 25% of our cases are done with clear aligners, the other with fixed. We've been using the Clarity Aligner system since it came out and been really happy with it. It's been fun to see it grow and develop and keep implementing new features like these grip attachments. I've developed kind of a reputation of thinking outside the box and using auxiliary treatments like TADs and hybrid treatments to get the job done as necessary. So I kind of get to apply my engineering degree a little bit
Yeah.
with some problem solving day to day. So a
Yeah.
little bit about me. And then in terms of aligners in our practice, we use them generally. I think I speak for all my partners and myself. It's not necessarily just adults or just adolescents. It's kind of just case selection based on what makes sense. Is the patient going to be compliant? Is this what they want? Is it a good case for aligners? And I've kind of developed a reputation for pushing the envelope with them. I've got a cool portfolio of challenging cases and great finishes on otherwise, that's typically not a aligner case, but let's do it. And with the right cooperation and patient disposition, it's fun to get it done. So yeah, I think aligners are a wonderful tool for the right situations.
Yeah. Okay. All right. So you mentioned it there, but we're going to focus in on the Clarity Precision grip attachments in this conversation. So talk to me about when you first began working with them. What stood out to you compared with kind of the conventional attachment workflow you were used to?
Yeah, great question. Maybe it's my engineering background, or maybe all of us orthodontists tend to be perfectionists and problem solvers. And I go through my workday and I'm always looking at different things in clinic that like, hey, I feel like we could do this even better. It could be protocols or materials, methods, systems we employ. Anyway, conventional attachments as we know them made my wish list on almost a daily basis. Just, I wish they were better. And anyway, when Solventum came out with these grip attachments, I was like, finally, they're finally here. This is what I've been dreaming of. I wish there was something better. We all know attachments are a necessary part of aligner treatment, but there's a lot of inherent issues with them, and we'll dive into that. But my first thought was just like, finally, they're here, and I was thankful to be part of the development and pilot testing of the grip attachments. And when we rolled them out, kind of what hit me most, besides just these are exactly what I've been hoping for, was they're actually pretty easy to implement for what they can do for the practice workflow and treatment outcomes. Actually, that was probably the second thing that hit me, was like, this really isn't that bad. Like they're pretty easy to implement. In terms of changes, some changes I've made to the practice, it's like, wow, that was really hard to roll out. It sounded simple on paper, and then you start implementing it. It's like, okay, we could have thought this through more, but Yeah, compared to conventional attachments, just making the switch hasn't been that bad.
Okay. So, from your experience and practice, where do the conventional attachments tend to create the most variability for the team or the patient?
Probably at the delivery appointment. What I've found in terms of things that disrupt our schedule and the flow of the day, I'd summarize it by saying anything that's unpredictable is prone to disrupting the day. And some appointments are more prone to surprises than others. Like, for example, retainer checks. Most of them, patients wearing the retainers, they're happy with the result, everything's going great. Keep up the good work, pat them on the back, see you next time, call me if you need me. But, maybe one in however many, it's like there's something off and there's conversations to be had. Anyway, at the aligner delivery appointment, that one with conventional attachments I found was less predictable. Things come up. You are trying to fill the attachment wells, whether you're using flowable or full bodied composite, whether you're doing it at the beginning of the day or chair side with the patient. It's arbitrary. Flash removal is definitely not an exact science, and there can be voids. There's all sorts of things that come up, and a lot of times we're finishing those appointments on time, but not always. Sometimes things would come up. There's a lot of flash removed. Sometimes uh, even a couple lower incisors get bonded together because there's enough flash overflow. And it's like, okay, that's gonna really disrupt the flow of the appointment. So that's I think that's probably the biggest variable is that delivery appointment. And certainly there's variability with the conventional attachments throughout treatment, and we'll get into that more, I'm sure. But at that first appointment, that's where you really feel the benefit of the grip attachments.
Okay. You talked a little bit about it there, but a lot of clinicians will think that, flash as a cleanup issue. Why is it actually more than that?
Good point. I agree. I mean, cleanup issue, yes, but exactly, it's so much more than that. For one, it's not a precise activity. It's as imprecise as filling the attachment wells. Even if you're wearing loops, even if you've got exceptional hand skills, removing flash is somewhat arbitrary. You're trying to get all the flash off, of course, but are you gonna gouge the attachment and disrupt its geometry? Are you gonna leave some flash behind? Maybe some of both. I mean, we're not human CNC machines. It's hard to expect to be able to mill it back down to what it's supposed to be on the screen. And so, and then not to mention it, anytime you involve the handpiece, it's more stuff to get out. It's noisy, and aerosols are all disruptive to the clinic. Patients don't love the handpiece. So, any way you can eliminate the use of a handpiece, it's definitely a win. So, I think that's part of the flash. And the other thing is it is humbling to get it all off. You'll do a refinement scan and you'll look at it and it's like, you think you're good and then you do a scan and the scans don't lie. You'll
Ugh.
see remnant flash, even
Uh-huh.
if it's just adhesive flash that shows up. And
Mhm.
of course you go back and get it, but the point is it's just it's tough. It's
Yeah.
tough to get it all and that affects the fit of the aligners. How could it not?
Yeah. Yeah, absolutely. So then, okay, so talk to me then about having a preformed 3D printed attachment. How does that change the bonding appointment for you, the doctor, the team, and the patient?
I think it helps each of those parties. From a doctor standpoint, I still go over and check the attachments once they're placed, but increasingly it starts to feel like a formality. Like I'm just going over just to say hi and because they turn out great. They're predictably good. But I still check them. From the patient standpoint, yeah, avoid the handpiece, and there's nothing worse than you're trying to deliver the best care you can, and first impressions make a big difference. So if a patient's starting off in treatment and all of a sudden, an attachment comes off, or they've got to go in and repair one because it had a huge void, or there's a lot of flash, and I come over and check, and there's still more flash to get off. It's okay, where everyone's doing their best, and as long as we get it right. But
Yeah.
still, you want patients, especially the first impression, to be the best possible. And if it feels like things are going wrong, understandably, you're going to start to question, like, what's going on? They had to redo that attachment twice. There was a void under it. They had to peel it off and get a new one on. So, um, I think from the patient standpoint, definitely a lot smoother. And then my assistants love it. When I was doing that beta testing, the pilot study on these grip attachments, we I remember I'll never forget the morning. It was fun. It's like, hey, we're trying something new. It's a really cool technology I've been part of, and I of course talked to the patient. Said, hey, here's what we're doing. Are you okay with it? And everyone was on board. I trained my assistants in. It was a pretty quick training session, but there's some little nuances to know. And then at the end, they were saying like, wow, these are really cool. I can see why you're excited about it. When are these going to be widespread use, or is this kind of one and done? And I was like, no, they're coming. It's exciting. And they're like, well, I can't wait till we get to use this on everybody. So really, in terms of me, the patient, and my team, everyone wins. It's great.
Yeah. Okay, so what have you noticed about aligner engagement and tracking when using these grip attachments?
Right. I'm convinced they fit the trays a lot better. Like, one of my mentors defines happiness as any time that reality exceeds the expectations. And it makes sense. Someone tells you your food's going to be ready in a certain amount of time and it comes out early, you're happy. But if it's much later than that, the expectation's not met. In the aligner game, in a way, the way I look at it is the expectation is that the attachment that's made in the mouth is exactly what is shown on the screen. After all, the aligners are fabricated off of what's shown on the screen as an attachment. So the expectation is that in the mouth, it's going to be an identical replica, but it's there's so much opportunity for error up front and along the way with attrition and fractures of attachments that it's like, how can you say these are accurate? So um, I'm convinced that my tracking is improved, and I know Solventum did a survey of orthodontists, and the overwhelming majority found that, yeah, like, we're convinced that there's better tracking. Of course, the fundamentals must be in place, good compliance and a good plan and all that, but I am convinced it's helped a lot. And I won't be surprised if, with further studies on the topic, if they come back and say, yeah, it's like, proven that it really improves tracking, even for tough tooth movements like extruding a lateral incisor and some of the notoriously challenging things. So it's exciting. It's fun to see it work. It's not only easier to place them, but they work better too. So
Okay.
it's been fun to see.
Yeah, you mentioned it there, but I was going to ask you, are there certain case types or movements or number of attachments that you've noticed a difference with?
Good point. I tend to use fewer, and this is with conventional or grip attachments, but I use fewer attachments. But when I do implement them, I use bigger attachments. And I I pretty much use grip for as many attachments as I can. Like, if I know I need it, I'll use grip if I can. There are some limitations due to the manufacturing. If you need a second attachment on a tooth, or if it's on the lingual surface, or if it's too close to the occlusal or gingival margins, then it's got to be a conventional. But otherwise, my team and I all are in favor of use grip whenever you can. And like, they're disappointed if they see
No.
the blue on the little odonogram map of where the attachments are going. They see them in blue. That blue is for the conventional, and green is for the grip attachments. And they're like, do these need to be conventional? I'm like, yeah, unfortunately they do. Do your, yeah, you still got it, but yeah, so they're kinda they love it. They're spoiled kinda with the grip attachments now.
Oh, there you go. Well, okay. So, durability is another area that matters throughout treatment. So, what should clinicians know about how these attachments actually hold up over time?
Yeah, that's another advantage. I think of it as, like, back to, restorative dentistry, anything made intraorally, direct restoration, direct composite fillings, versus anything made in the lab, crowns, etcetera. Anything made in a controlled lab environment is gonna be of higher quality, surface, porosity, material strength, etc. So, for the Solventum grip attachments that are, it's cool. It's a 3D printed, proprietary, fully cured composite, and it's a lot more durable, stain resistant, because it's not going to have the surface porosity that something made on the fly intraorally is going to have. So they've shown it resists staining dramatically more than any of the composites compared against, and durability, they're not as prone to attrition and fractures as conventional attachments. So it's cool. I don't know how they do it. I think it's proprietary technique, but 3D printed composite. And another advantage of it being fully cured and ready to go is when you're gluing them to the teeth, conventional attachments, you don't really want to push the curing light on the attachment too hard. I mean, you want to adapt the aligner template to the teeth, but if you push on the attachment too hard before it's cured, you'll distort it. The plastic's somewhat soft. But with the grip attachments fully cured, we actually recommend pushing the attachment against the tooth fairly, with fairly firm pressure. Use the curing light tip and push it on there before starting the light up. And that way you're really limiting the bond interface between the intaglio of the attachment and the enamel surface. And the thinner the bond interface, the better the bond strength. And you can do that with grip attachments because they're fully cured. So that's why it's such a perfect solution that they're just out of the box, custom made for each patient, fully cured, and a more durable material that's going to resist damage throughout treatment, which is great. You can trust it's
Okay. All right. So, what advice would you give to a doctor who is interested but wants to make sure that implementation goes smoothly?
great. Good point. Yeah, anything new. Yeah, you need to. I'd say my best advice is, it sounds kind of silly, but read the instructions. It's not the most challenging thing to implement. In fact, I thought it was pretty straightforward, but there's a couple nuances that make sense once you understand it. But for example, there's in the welcome kit, when you order your first grip attachment, they send you all the materials you need to bond it. And there's a primer in there that you may or may not already have stocked. So definitely use that. And we all want to keep inventory low on how many products you stock, but there's been a ton of quality research done on what's the best way to make these work. And so follow the directions, don't shortcut it. I'd actually say, easier than the conventional attachments to place. So follow the directions. Consider getting your rep involved if you want to. I'd encourage it. They may even want to be there for the first bonding and kind of shoulder surf and watch the process and make sure it goes off smoothly, and may have some helpful tips for you. So
Yeah.
that's how
Yeah.
I'd go about it. I was involved with the development, so I was really familiar with each step and why it
Yeah.
mattered. But if this is new to you, just, yeah, read the directions, talk to your rep, and it should go off really smoothly.
And it sounds like when you were kind of doing that beta testing with your team, that it was you showed your team how to do it. It was a fairly easy transition for them.
Totally. Totally. Yeah, I I think the date kind of crept up on me, and I feel like I under prepared them. I was just like, "Hey, we're doing something new today. Here's the scoop. Here's the steps. I'll kind of keep an eye on it, but I got a consult to hop into, and let's see how it goes. Let me know if you got any questions." It was a pretty basic crash course, and everything stayed on and everything was great. And they're like, "Yeah, we love it. It was great." And the patient gave me thumbs up. They're like, "Yeah, cool product. I don't know any different, but this seemed to go pretty smooth." I was like, "Great." So it was fun.
Just what you want to hear.
That's right. Yeah, exactly.
All right. So if you had to summarize the value of the Clarity Precision grip attachments in one sentence, what would you want clinicians to remember?
I would say, in the spectrum of new technologies and things that you can implement, for what grip attachments can do for your workflow and predictability of the delivery appointment, and tracking and stain resistance, etc. For how powerful of a change it can make to your process, it's actually quite easy to add into your protocol compared to, many other new things out there. There's so many great things you can consider implementing, but this is an easy one to do it with.
Yeah. Well, Dr. Crary, it's been great talking to you. I really appreciate you sharing your experience.
Yeah, it's been a privilege being here. Thanks for having me.
As always, thank you for joining us. Be sure to subscribe to the Orthodontic Products Podcast to keep up with the latest episodes, and be sure to check out orthodonticproductsonline.com to keep up with the latest industry news. Until next time, take care.